We found out by surveying Southeast Fayetteville that there were a lot of people that didn't have physicians. They didn't have the money to go to an office. There were a few people that we got together and we talked about it for a while. Then we decided we either stop talking and do it or we just forget it. But it was something we could not forget, so we kept talking.
35 years ago, a group of concerned citizens known as the Southeast Fayetteville Community Action Committee followed the recommendations of local icon Jessie Bryant, who believed her uninsured, low-income neighbors needed access to quality health care, and the Northwest Arkansas Free Health Center was born.
To talk about the Free Health Center is a joy. We didn't have a place to do this. We didn't have anything. It was, to begin with, we set it up as a free health center by volunteers, which meant that we had to go out and convince nurses, physicians, personnel, whatever, to volunteer their time. We did this and we set it up to do it on Thursday evenings beginning at 5 o'clock.
I'd like to share the impact that Northwest Arkansas's Free Health Center is making daily on the health of our region and how you can help. In 1986, Mrs. Jessie Bryant began her service as the first executive director of the Northwest Arkansas Free Health Center. She solicited the assistance of Dr. Liz Rant to volunteer as the first physician of this one-day-a-week clinic housed in the basement of the historic St. James United Methodist Church on the corner of Center and Willow Streets in Fayetteville. Neither the committee nor Mrs. Bryant could have anticipated the full extent of the need. In 1988, increased demand for services and space led to a relocation of the clinic to the basement of the former National Guard Armory building south of historic Washington County Courthouse on College Avenue. Because it was evident there was a need beyond medical care, Drs. J.B. Hayes and Bill Roberts started the Dental Extraction Clinic.
I'm J.B. Hayes, DDS, an oral surgeon here in Fayetteville, and I helped start the dental clinic because there is such a need with a good portion of the population. Many of the people did not have insurance also, so this helped a lot of people.
A lot of people have neglected their oral health for a long time, and they come to us for relief of pain and suffering. We're basically the last resort. When their teeth are beyond repair, they come to us. We're the only free dental clinic in this area. And if they don't come to us, then they have to go to the emergency room where they really only get help for their pain, but not really for their problems, their oral health. And we're here to help.
When we started that, we didn't know if the community was going to come aboard and use it. We didn't know if the people that we were serving, we didn't know if the physicians were going to come aboard and volunteer their time after having worked all day. So we took it on faith that when we moved from the church to the armory, we had 65 people that night, and our little church is small. But we put them all in there, and we saw every one of them. From then on, we went from 40 to 75 or 80, as many as we could take care of and not overdo or not shortchange anybody. But they got the full account of what they needed. They got to see a physician. They got to tell their story. And we worked for the city, for the county, for the community, for whomever came in.
It was in this small clinic that I began assisting Dr. Hayes as a pre-dental student volunteer. Seeing the relief on the faces of our patients and their enormous gratitude for the care we provided cemented my commitment to helping patients through volunteer work. In 1996, in that same building, remodeling took place on the main floor, and the clinic moved up to the 6,000 square foot space. Back then, the clinic provided primary medical and pharmaceutical services using 15 medical volunteers. Dental services were provided by a handful of volunteer dentists assisted by pre-dental and pre-med students. Hours were a half day on Wednesday for medical care and a half day on Thursday for dental care.
My name is Sandra Ramirez, and this is my mom, Leonor Kivaja. She lives also in Fayetteville, Arkansas. We drove by the old location that was in College Avenue. It was the old name, the Northwest Arkansas Free Health Center. My mom has been a patient at Welcome Health for ¿hace cuánto tiempo ha sido paciente aquí en la clínica?
Como unos 10 años, tal vez.
For about 10 years.
I originally heard about Welcome Health back when I first moved here in 2010. Back then I had no job for quite a while. It was hard trying to find something then. And at the time, my ex currently, we were married and we were looking for a place for cheap or free health care because we needed something for some of our conditions we needed coverage for. So we did some searches and looked around and we found Welcome Health at that time.
Moving here from Texas to Arkansas, I knew there was a lot of attention health-wise that I was going to be needing. So I had to do a little bit of research, of course. And I did Google several different clinics, but Welcome Health came up. So I decided to give them a call and just ask a few questions about what they were offering. And they did consider my income level. And at that time, I was not working. So they set an appointment for me to come in, and they did an evaluation on me, and I got enrolled.
I'm from Fayetteville, Arkansas. I'm self-employed carpenter. Yeah, I found out Welcome Health from my daughter. She told me to come here when I was having heart problems. And so I come here and had lots of heart problems, and they fixed me up really well.
So why did the name change to Welcome Health? Plain and simple. We changed our name to Welcome Health for our patients. Unfortunately, sometimes the word free can have a negative feeling. We wanted our patients to rest assured that they receive quality care at our clinic. We wanted our patients to know that we value them and their health. Welcome Health treats all patients with respect and dignity while providing free quality care and dental care to those who can't otherwise afford care.
While our medical staff of a part-time nurse practitioner and part-time RN covers general medicine, we have the specialty doctors that come in on an as-needed basis to cover additional services of gynecology, pediatrics, physical therapy, mental health.
My name is Vicki Kimball. I live in Springdale, Arkansas. I've been there about 25 years. I worked in Bentonville and drove back and forth all the time, so it was nice to have a place in Fayetteville to come that was so calm and not on the highway. The nurse here taught me how to give myself insulin shots first. They referred me out for the breast, the gallbladder, and then I had to have some physical therapy afterwards to be able to pull the back of my sweater down. And they sent me there too. It's been a wonderful, holistic experience for me.
You know, I remember one time I come in here with high blood pressure and they wouldn't even let me leave until my blood pressure was normal. And it took a long time for it, but anyways, that's how much they care about people. They care about you and they take care of you. They're kind, wonderful people.
There were some patients that didn't need a physician. They just needed somebody to talk to. And we sit down and we would just have a conversation. But the people needed an ear to listen. And the one thing that I would always stress to the workers that came in, you have to be a people person and you have to understand that you are not boss. You are just one of the people that is working within the confines of the things that we do and that we have, and be joyful as you do it.
A memorable patient story for me was a patient that came in during one of our extraction days. We tested her blood sugar and it was 890. We didn't even believe the results we got, so we tested it again and it was even higher. So in addressing a dental problem, we actually found a medical concern that needed to be addressed by Welcome Health, and we got that patient care. Welcome Health operates with a full-time staff of 2, a part-time staff of 6, and an army of professional community volunteers. General medical care is provided by a staff nurse practitioner, an RN Monday through Wednesday, and specialty care by volunteers during the Thursday evening clinic. Specialty volunteers are scheduled as needed every few weeks.
Hi, I'm Monica Fisher-Massey. I'm the Executive Director of Welcome Health, which is the former Northwest Arkansas Free Health Center. I started in 2002 when the clinic was still located in the former Army building, which is next to the old courthouse on College Avenue. We had a tremendous demand for our services. There was nobody else in the area that provided free health and dental care. So we had no choice but to expand because of such a great demand. So we decided to move into our current building, which is on Woolsey Avenue, which is the former Washington County Health Department, basically to accommodate the need for our services.
Compared to our previous location, this is a modern, beautiful facility, but it still has the same warm and caring staff.
Well, there is a big difference between the old clinic that was on College Avenue and this one. As far as x-ray goes, we have a computerized and digital x-ray machine instead of film. That's a lot easier for the dentist. They're able to look at an x-ray right at the side of the patient in the chair. It's a lot brighter. There's a lot more room. There are 4 dental chairs. We didn't have 4 back at the old facility, so there's a lot that's better here.
Hello, I'm Brittany Gully, the Director of Development here at Welcome Health. I've been with the clinic for a little over 5 years. I am just blown away every day at the passion from the staff to the volunteers to the pre-med and pre-dental students that help us out. I just get this warm feeling when I read those comment cards from patients who really are thankful and grateful for the services that they receive here. It's needed. People have this perception of Northwest Arkansas as being prosperous and, a great place to live, and you can find a job on every corner. And sadly, right in our own neighborhoods are people who need the services of Welcome Health. So I just want to continue to spread the mission and let people know that we are here and we want to have a healthy community, a thriving community, and it starts with the services that are offered here.
Hi, my name is Jim Norris. I'm the medical director and board member here at Welcome Health. When I first moved to Fayetteville, my good friend Dr. Roger Montgomery asked me if I'd be interested in helping out at the local free health clinic, and I thought, sure, why not? And he invited me to take a tour and fell in love with the work that was being done, and I've been here ever since. I have volunteered here for over 20 years. Yeah, for me, giving back to my community is really important, rewarding work to help my friends and neighbors who would otherwise go without medical care.
Hi, my name is Beth Nay, and I am actually a volunteer here at Welcome Health as one of the nurses. I've been a volunteer now at Welcome Health for the past 3 years. I became a volunteer at Welcome Health because it's one of the best services that I can think that where you give back to the community. It's something that I've wanted to do and thought about for a long time. My previous job did not allow me to have a lot of free time, and so whenever I changed jobs, I was able to join the family here at Welcome Health.
When I first moved here, I knew I wanted to get plugged into the community and give back in some way, and I actually asked my boss at the time, Carl Collier, what a good place would be for me to land to give back, and he immediately said the Northwest Arkansas Free Health Clinic, and so I volunteered there. Then, of course, the name has since changed to Welcome Health, but I've been doing that for 26 years. It's changed a ton over the years. Started back in the basement of the Armory building to this amazing place we have now, but again, the fact remains there are people in the community that need it.
You know, I became a volunteer at Welcome Health in 1989 when Dr. Hayes told me that we were going to Welcome Health. And so he introduced me to the clinic as his pre-dental assistant, and I've just been hooked ever since.
I have been amazed over the years at the consistent caliber of quality staff who volunteer here. It's one of our missions is to provide a place to experience the joy of service and volunteerism.
My name is Albert Gray, and at Welcome Health, I help the dental clinic by taking the Panorex x-rays right here. I keep coming back to volunteer because the community needs this kind of service, and for myself, I'm grateful that I can come back here and help.
The Thursday evening dental extraction clinic is manned by volunteer dentists, oral surgeons, dental hygienists, an x-ray technician, and many, many, many pre-dental student volunteers.
What keeps me coming back is there's a tremendous need of many patients in this area who do not have medical or dental insurance. And also, there's many students that see what they're getting into. They're preparing themselves for medical and dental school.
I am a pharmacist volunteer at Welcome Health, and I am a Welcome Health donor as well. I keep coming back to volunteer at Welcome Health because they need me. There is a need in this community, and as long as there continues to be a need, I will gladly volunteer.
I have heard somebody mention that they volunteered at the dental clinic, at the free dental clinic back then, and I thought, boy, that sounds like something I'd be interested in and could help. So back in 1996 is when I first came to volunteer.
Well, my name is Dr. Margaret Rutherford. I'm a clinical psychologist, and I do mostly therapy here at Welcome Health. I see but pre-COVID, I saw about 3 patients every 2 weeks and carry a load of anywhere from 5 to 6 patients. I've been a volunteer, I think, for almost a decade, if not a little bit longer. I remember walking into Monica's office at the old free health clinic, and I knocked on the door and said, you know, I'm Margaret Rutherford, I'm a psychologist. Do you have any mental health services? And she said, we've always wanted to have mental health. And I said, well, now you've got it.
Quest Diagnostic performs free testing for our uninsured patients. Northwest Arkansas Pathology Associates and Washington Regional assist with additional services our providers need to diagnose and treat our patients. How are these services provided for the community at no cost? For the last 35 years, we have survived thanks to the generous Northwest Arkansas community support. There is a misconception that this clinic is funded largely by the government. Truth is, only 14% of the annual budget is covered by grants from the Arkansas Department of Health and Community Development Block Grants funded from the City of Fayetteville. The rest of our support is provided through donations from foundations, churches, civic groups, corporations, individuals, and special events.
So Washington Regional has been a partner with Welcome Health really since the very beginning. It's intriguing that the mission of Welcome Health is to improve the health of our community, especially taking care of everyone, whether they have the capacity to pay for that care or not. That mission statement fits very nicely with Washington Regional. As a nonprofit health system, we also, our mission is to improve the health of the entire community, and that includes those that may or may not have the ability to pay for that care.
The Walker Foundation has been supporting Welcome Health for more than a decade. In 2007-2008, the Walker Foundation realized that Welcome Health, formerly known as the Northwest Arkansas Free Health Center, aligned with our mission to help individuals reach their full potential in life.
You know, one of our company's core values is to make sure that we support and we give back to the local community. Anytime we team up with an organization, it's important to us that they have the same core values. I think Welcome Health is a prime example of that. And we really appreciate how they reach out within the community. They provide medical and dental assistance. No matter what the obstacles are, they look for solutions to be able to get people help.
I support Welcome Health because the program at Welcome Health is a difference maker in Fayetteville and throughout Northwest Arkansas. I've been a donor for 20 plus years, and I first became familiar with this program because of my mother's involvement from the very beginning of the free health program. She loved this place and she believed deeply in the mission, and I grew to deeply believe in the mission also. I support Welcome Health because I believe it's an important part of our healthcare system here in Northwest Arkansas. It serves a vulnerable population, people who are in a situation where they're unable to afford basic medical and dental health care. And I believe that the essence of any great community is a community that reaches out to the most vulnerable among us. And that's what Welcome Health does. It's here for people who need the kind of medical care and dental care that they deserve. So that's why I support Welcome Health.
Over the last year, it's impossible to look back and not see what the impact of COVID and the pandemic has been. With the concern that many of our community members have had with seeking care, how to best partner to be sure there's continuity of care. This partnership is a living, breathing partnership that feel very good has changed as needs across Northwest Arkansas have changed.
Yeah, for me, giving back to my community is really important, rewarding work to help my friends and neighbors who would otherwise go without medical care.
There are currently 60,000 people in Northwest Arkansas living in poverty without health insurance. Our recent pandemic has likely caused those numbers to increase as more and more people find themselves without employment and health benefits. We need funds to invest in those who need health care now. If you believe everyone deserves quality care regardless of their ability to pay or their insurance status, then we ask you to consider a donation to Welcome Health. This clinic is a nonprofit charity organization. Most donations are tax deductible. Did you know that investing in free health care for our most vulnerable populations helps our community in the long run? When employees are healthy, they are more productive on the job and keep coworkers from getting sick. When students are healthy, they have lower absenteeism and they learn more effectively and they have higher graduation rates. Your support of a free clinic providing preventative care means access to care and fewer costly visits to our local emergency room. A healthy community is a thriving community. If you know others who have a passion to give back to their community, please help introduce them to Welcome Health. Our staff would love to give a tour, have a coffee, or discuss gift opportunities with anyone who has an interest. Connect with us on our social media channels to keep up with what's going on at the clinic. Follow up, engage with our posts, and share our stories.
It is necessary to have a free clinic because if we were not here, they would not have a place to go.
So we heard from Miss Jessie Bryant and her original vision of starting the clinic and forming a committee to put the thoughts together and survey their neighbors and realize that there was a need for free medical care. And I think one of the biggest things we can take away from what she told us is from the very beginning, it was about respect and dignity. Everyone is treated equally at the Northwest Arkansas Free Health Center, and even today, people are treated equally. They are shown the respect that they deserve. They are given the time to voice their concerns and their opinions, and our providers take the time to listen and be there for them and showing them that same respect and dignity. But our mission still remains 100% the same. People need us, and we are here for them.
One thing is the tremendous need of many of the people who do not have the financial capability or insurance to help them with the needed treatment, which we can provide.
I think everyone deserves good quality care, and here at Welcome Health, you can expect great quality health care regardless of your ability to pay. We are a gem in the community, and I wish more people knew about us.
Welcome Health makes Fayetteville and Northwest Arkansas a healthier community. It also makes this a better community because of the excellent physicians and dentists, nurses, and other healthcare providers at Welcome Health. This program is able to provide the kind of quality health care that people need, and it's essential, I think, that our community have a place like this. That's why it's been here 35 years. That's why it's been so successful, and that's why it's made such a difference in the lives of so many people. This program depends largely on the generosity of people throughout this community.
The overall benefit that I think Welcome Health brings to our community is the fact that they are part of our community. When we talk about a healthy community, we need Welcome Health. They offer dental and medical services to anyone in our community. They service the uninsured, the underinsured, and the insured. And without having an opportunity for quality health care for anyone in our community, we cannot reach a healthy Northwest Arkansas.
A patient I just saw yesterday looked at me and said, I can't believe that I'm getting services finally for what has been troubling me, and the fact that Welcome Health is here. Welcome Health is something that people can count on when their lives are chaotic, and I think that's so important because really more than the medicine or therapy or whatever we have to offer, the fact that we care and that we're here is so important to them feeling as if there is some hope in their lives.
Yeah, I've been a donor for many years. I think it's important to continue to support this clinic financially and with volunteer hours.
One thing I really want the community to know and to realize is that, number one, Welcome Health is here. We offer a fantastic array of services, and with that, we also need help from the community. It's a give and take relationship. And one of the things we need is continued support from the community to continue doing good services.
It takes everybody in the community, or those who believe deeply in the mission of Welcome Health, to give as generously as they can, because that's how this program at Welcome Health is able to provide free services to those who need it.
After hearing this message, you feel inspired to give back. We are always looking for professional volunteers or financial support to help support the important work being done here.
Thank you for your time. We hope you'll share the story of how this small clinic is making a big difference in our community. We certainly wouldn't be where we are today without our organizational visionaries, our amazing volunteers, and supporters like you. Special thanks to the sponsors who have helped make video possible. On behalf of the staff, volunteers, and patients of Welcome Health, I'm Kenton Ross, signing off with a huge thank you for your support.